Hello, so we will go ahead and get going for our Research Methods webinar. So our presenter today is Katie Burgess, who's a Senior Epidemiology Analyst in the Methodology Core. So I'll turn it over to Katie.
Okay, thank you, Susan. Good afternoon. I'd like to welcome you to the Collaborative Research Center for American Indian Health's webinar on research methods. Like Susan said, my name is Katie Burgess, and I am a Senior Epidemiology Analyst and member of the Methodology Core, and I am joined today with Susan Puumala, Director of the Methodology Core. Our role as members of the Core are to provide education and training on topics related to research methodology, as well as offer consultation services to any investigator working through the research process.
And I just wanted to make, one housekeeping announcement. If you could mute your lines while we're doing the presentation, that would be great. And then when we're finished with the presentation at the end, we'll open it up for questions. Thanks, Katie.
Thank you, Susan. Okay, so our goal today is to provide you with an overview of the general research process, detailing the methods taken in planning a research study, to help you then follow these methods and apply them to a research project, and to also explain how the Methodology Core can help you in working through this process with your own research. As we discuss the different steps of the research process, we will work through an example. Please note that this training is meant as an overview of the general research process and research methods. For more specific research topics and detailed trainings, please contact us at the Methodology Core. So as we walk through the steps of the general research process, let's apply them through the following example. Let's pretend that you are a researcher wanting to study a health priority in your community. We will help you apply the general research process to your study idea. This example is modeled in the format of a consultation from the Methodology Core. Research methods are the steps you take in developing and conducting a research study. These steps can vary depending on the type of research being conducted, but most researchers follow the same general process. In this training session, we will discuss the following 6 steps that make up the general research process. These are formulating a question, designing your study, collecting your data, testing your hypothesis, forming a conclusion, and finally sharing your results. So step 1 is to formulate a question or topic that you are interested in possibly studying. This step includes defining the question, reviewing what has been done in your topic area, and developing a hypothesis. So when we say to define the question, what we mean is to narrow down an area that interests you and that you would like to study. You can also think about topics of interest or health priorities within the community or population that you wish to study. For example, you might ask yourself, what health topics are commonly discussed in my community? Or, what are some health needs that I have observed within my community? Once you have that question or topic in mind, you then need to review what has already been done in that area. To do that, you perform a literature review. So let's go back to the example. Let's say you are interested in knowing more about diabetes in your community and what you can do to help prevent it. Let's narrow down what you want to know. Sorry about that. Do you want to know if more people are getting diabetes in your community? Let's say you answer yes. You want to know if the rate of diabetes is increasing or decreasing in your community. The next part of this step is to review the current literature on diabetes in American Indian communities. A literature review is a method for assessing what is already known about your area of interest. It is a systematic approach to uncovering patterns in current research and potential gaps in knowledge. By performing a literature review, you are able to find out what studies have already been done on your topic. It helps you determine if your question has already been answered, and if it has, how you can potentially build on what has already been done. The steps to performing a literature review include identifying your topic, determining which databases and sources you wish to review. Some examples include PubMed and Google Scholar, and reviewing the articles associated with your topic. As you begin to collect articles associated with your topic, you will want to group them into categories. You may not know what these categories are in the beginning, but they will become more apparent as you read through the articles on your topic. These categories are what will help you uncover patterns in what has already been done. As you categorize your articles, you will want to take notes. While taking notes, pay special attention to patterns in the studies that you are reviewing and look for gaps in knowledge. Ask yourself, why do these exist? And finally, as you take notes, you will want to organize them into a summary format. This could be as simple as note cards or more in-depth, such as a concept map or database using Excel or Access. Again, this is just a general overview on how to conduct a literature review. If you have more detailed questions on this step, please let us know at the Methodology Core. The next few slides will go through examples of different resources available to you when performing your literature review. Let's first go through an example of searching articles using PubMed. I want to stress the importance of using reputable search engines. When performing a research study, you do not want to use resources such as Wikipedia for your review of current literature. PubMed provides a way to search scholarly articles that have been published in reputable journals. This means that the information obtained in these articles have gone through a rigorous peer review before being accepted for publication. This is a screenshot of a PubMed search. I want to call your attention to a couple of areas. First, you will see that I typed in 2 keywords in the search line. I used diabetes and American Indian. Keywords are very important to your search. They help narrow down articles to those that cover the topics you are interested in. For example, I could have done a search on diabetes alone, but I would have gotten thousands of articles that may have nothing to do with American Indians. By using both of these keywords, you can see the results list is still large, but nowhere near as large as it would have been if I only searched one broad topic. I also want to point out that PubMed bolds your keywords if they show up in the title of the article or publication. And under the title, you can also see a listing of the authors, the journal, and the date the article was published. When you select a title, you are taken to this screen. This screen provides you with an abstract or short summary of the contents within the article. This is a fast and easy way to see if the article contains information related to your topic of interest. I also want to draw your attention to the keywords listed with this article. These will give you more ideas as to what the content of the article is discussing, as well as other keywords you might want to use to narrow down your search. In the top right-hand corner of the screen, you will see the different sources where you can obtain a copy of the article. For example, this article happens to be free to view in PubMed Central. If you click on this link, it will take you directly to the full article. Below this section is an area called Related Citations in PubMed. This is a great shortcut to articles similar and related to the one you are currently viewing. I also want to mention a couple more resources that you should use outside of PubMed and other publication search engines. The Centers for Disease Control and Prevention also provide valuable resources, including data and statistics on specific health topics. In these screenshots, I show you how you can go to the CDC webpage, type in diabetes in the search bar, and find an interactive atlas on diabetes that can provide data all the way down to the county level. By selecting the county level interactive map, you could choose the state and counties that your community resides and see what statistics the CDC has on diabetes diagnoses. In this example, I searched the entire state of South Dakota. The darker the colors on the counties, the more cases of diabetes that have been diagnosed. Another valuable source of data can be the State Health Department. In this print screen, I show you the South Dakota Department of Health webpage. I selected Health Data and Statistics from the home screen and was directed to this page, which contains a wealth of information on hospital and workforce data, risk factor surveys from the CDC, and vital statistics for the state. Once you have completed your literature review, you are ready to create your study hypothesis. The hypothesis is created from the information that you gathered about your research question in your literature review and is a statement about what you think your study will show. It should be a statement that could either be true or false, but should be what you think is true. And finally, your hypothesis should be something that is testable. When forming a testable hypothesis, it should include a prediction in the form of a question or a statement. By testable, we mean that the hypothesis is a statement that can be supported as true or false through data. And remember to keep your hypothesis simple, something that can be tested using current resources. So let's return to our example. On this slide, we show you examples of a poor hypothesis and a good hypothesis. Let's look at the example we have of a poor hypothesis. Diabetes will always be a problem for American Indians in Community A. You might be asking yourself, why is this a poor hypothesis? While this is a prediction, it does not meet our qualification of being testable. Look at the use of always in the statement. We can't test if diabetes is a problem for American Indians in Community A 100 years from now. This hypothesis is also not specific. What does a problem actually mean? Now take a look at the example of a good hypothesis. The rate of diabetes diagnoses in American Indians of Community A has increased from 2010 to 2013. This is a good hypothesis because it is based on information gathered from observations and a literature review. It can be verified through current techniques and data collection. And finally, only one question is asked, and it is specific. So once you have your hypothesis, you're ready to begin step 2, designing your study. When designing your study, it is important to choose a study design that will help you collect the data you need to test your hypothesis. There are many different types of study designs, each with their own advantages and disadvantages. Studies generally fall under 2 main categories, experimental or observational studies. The key difference between these two is that in experimental studies, the investigator manipulates who receives the prevention or treatment being studied, whereas in observational studies, the investigator only observes. An example of an experimental study is the clinical trial. In this type of study, there are usually 2 or more groups assigned different treatments, such as active or placebo. Observational studies include cohort studies, where subjects are defined according to their exposure status and followed over time to determine occurrence of symptoms, disease, or even death. In these studies, subjects are selected as exposed or unexposed. Now, in the case control studies, subjects are defined as cases if they already have the disease of interest or controls if they are disease-free. Then exposure histories are collected and compared. And finally, the cross-sectional study is a snapshot of a population at a single point in time. They measure disease prevalence in relation to exposure prevalence. And like I said, all of these designs have advantages and disadvantages, and these are only a few examples of some of the study designs that you may encounter in your research. The important thing to remember is that you design your study so that you collect the necessary data to test your hypothesis. Make sure that the type of data and the method of collection provides you with the information you need. And please remember that the methodology core can help you determine which design is right for your research study if you have any questions. So how can you design a study that answers your question? As part of the methodology core services, we can help you design your study so that you collect the data you need to answer your question. Think about your hypothesis and the type of data you want to collect. You want to see if diabetes diagnoses are in fact increasing in American Indians in your community. What type of information do you need to collect to answer this question? In this example, we may ask you, do you want to collect new data or are there existing sources? And then give you examples of different study designs and the type of data you would need to collect. For your study, you could look at 2 possible options. A study that uses a survey to poll the community on diabetes status and diagnosis state, or a medical records review where you can abstract medical records from clinics in your community and obtain diabetes status and diagnosis date directly from the medical record for the time frame you wish to study. There are pros and cons to each design. Surveys are easy to administer, cost-effective, and you can collect a broad range of data that you would not be able to get from a medical record, such as attitudes, beliefs, and behavior. However, surveys can be difficult in getting people to respond. Participants may not provide honest or accurate answers, or they may leave questions blank altogether. A medical record review utilizes existing data in the patient's medical record, so you do not have to worry about inaccurate reporting by the participant. For example, the diagnosis date that could be difficult for a participant to recall would be recorded in the medical record. However, some disadvantages to medical record reviews are the use of medical terminology and acronyms that may be hard to interpret. It can be time-consuming if the records are not electronic, and there is still the potential for missing data. Since you want to get a count of American Indians diagnosed with diabetes each year in your community from 2010 to 2013, I would recommend a retrospective medical record review. This would mean that you would collect data directly from medical records in your community for the specified years. Okay, so now that you've created your hypothesis and designed your study, you can move on to step 3, collecting your data. This step is where you get to actually carry out your study design and organize your data for testing. The type of study design you choose is based on the type of data you want to collect. Data collection can be done in a variety of methods, including medical records abstraction, biological or laboratory samples, surveys, or data that is already available in a public database. Just remember to collect your data in a systematic way. Data collection methods should provide you with the cleanest and most accurate data as possible. For example, with survey development, you should make question responses close-ended. That way, you receive clear answers that are formatted the same way from participant to participant. If you leave all of your answer options as open-ended, then you are more likely to get unclear answers, a misunderstanding of what the question is asking, or even skipped answers. So how do you actually perform your medical record review and collect the data you need? Think about the quality of the data and any types of potential bias. For example, when doing a chart abstraction, you might think about the population that goes to the clinics that you are working with. Does it cover all of the population? Are there likely to be any elements of the data or cases missing? How are you going to define a case of diabetes? What specific information are you going to abstract from the medical records? And also, you will need to consider all of the rules and regulations involved in accessing and collecting medical record data. What type of certifications do you need to handle patient data? What institutional review boards will you need to obtain approvals from to access clinic records? Within the Collaborative Research Center for American Indian Health is the Regulatory Knowledge Core, and they will be able to help you with any questions or concerns related to regulatory matters. Based on the types of data you have collected and the method of collection you have used, you will need to organize your data so that it is in a format you can use during the analysis. For example, if you perform focus groups or interviews, you will need to transcribe your audio recordings into text documents for qualitative analysis. Or if you've collected surveys or data from medical records, you will need to enter it into a database for further statistical analysis. Once you collect the medical record data, what should you do with it? Creating a database or file that helps you store all of your collected data in an organized manner would be your best option. A database can be a spreadsheet in Excel or perhaps another program such as Access. Your database should provide you with consistency, security, and structure. Once you have collected and organized your data, you're ready to test your hypothesis, which is step 4. Step 4 includes analyzing your data and checking to see if your results support your hypothesis. You finished collecting your data and are ready to analyze what you have. What now? Now you are ready for step 4. As part of the methodology core services, we can help you describe your data, analyze your data, and write up the results of the data analysis. Describing the data is when you provide a summary table that describes the data you collected and the population represented in your sample. The intent is to provide a simple way of looking at a set of data and is the first step towards interpreting the data. Both description and analysis of the data is dependent on the type of data collected. There are 2 different types of data, qualitative and quantitative. Qualitative is data that describes something in a non-numeric way. In other words, qualitative data is something that can be observed. Examples of possible qualitative data that could be collected are recordings and transcriptions from focus groups or key informant interviews. Quantitative data, on the other hand, is numerical and provides the quantity of something that can be measured. For example, age, weight, and time as collected through surveys or medical records. So what would be the best way to describe the data you collect from your medical record review? I would recommend providing a summary table or other visual representation of the data you collected. You could provide frequencies and percents for variables such as gender, race, diabetes diagnosis, and marital status. You could do the same with age if you wish to group age into categories such as 25 to 49 and 50 years old and older. Or you can provide means and standard deviations. You could also present summary data in different ways, such as through the use of pie charts or bar graphs. Once you have your data in an organized and usable format, you can begin your analysis. The type of analysis you use is dependent on the hypothesis you are testing and your study design, as well as the type of data you have collected, qualitative or quantitative. Remember, you are testing whether your hypothesis is true or false. You are not proving anything, you are supporting or refuting. So let's remember your hypothesis. The rate of diabetes diagnoses in American Indians of Community A has increased from 2010 to 2013. Your analysis should help you in supporting this statement or rejecting it. Therefore, you want to show the trend of diabetes diagnoses over time from 2010 to 2013 for American Indians in Community A. You could show this trend graphically to help display the clear increase in diabetes diagnoses over the time frame. In this example, you found data that supports your hypothesis. Step 5 of the general research process is when you form a conclusion based off of the results gathered from testing your hypothesis. During this step, you want to look for other possible explanations for your results, try to generalize your findings to the real world, and make suggestions to further research from the results that you gathered. So you have your results, now what do you do? Every good research study is reproducible. This means that someone else can come in, follow your design and methods, and arrive at the same result. So now would be a good time to recheck your process and analysis. Remember, step 5 is about forming conclusions from your results, so really examine what you found. Did your results support your hypothesis or not? Has diabetes in your community increased since 2010? Think about what you learned from your study. Is the community you used in your study representative of the entire population? Can the conclusions you draw from your study perhaps be true for other communities as well? Ask yourself, what are the strengths and limitations of your study? How do your results guide researchers in the future? Once you have your results and formed your conclusions, you should share these findings to others. There are many different ways you can share your results, such as presenting your findings to other researchers at conferences, or to community members in a public forum, or by writing a report or manuscript. The important thing is to share your results in some way, because as you see, research is a circular process where through sharing your results stimulates another to ask more questions. So how do you share your results? It is always best to present your findings back to the community you have studied. You can also submit an abstract to a conference and present a poster of your findings to other researchers who have common research interests. Always remember to tailor your presentation in a way that is most useful and easily understood by your audience. Should you prepare a report or manuscript? Yes, it is always important to write up your findings, whether in a report to key stakeholders such as community members or a manuscript for publication. Now that we have worked through the general research process in our example, I want to reintroduce Susan Puumala, Director of the Methodology Core. She is going to share some more information on what the Methodology Core is and the services that we provide. Afterwards, we will be happy to answer any questions you might have on research methods or the Methodology Core services. With that, I am going to hand things over to Susan.
So thanks, Katie, for a great presentation on research methods. And I wanted to just make another plug while we have the opportunity of what services the Methodology Core offers for our partners in the Collaborative Research Center for American Indian Health. So what we really want to do through the Methodology Core is support research and research infrastructure building. So we want to work through with our partners, understanding what your current interests are, and figure out if there's a way that we can work together through collaboration on projects, or maybe helping out with some training that we can enhance your research process. And then also we can provide expertise that you may not have now. So we can help you now with expertise and then provide you with resources so that you can have the expertise yourself in the future. So the core things that we're trying to do is provide education and training on research methods. That includes study design, statistical analysis, epidemiology, research methods, and anything that you can think of that you'd like a little bit more education or training on. We also provide assistance with data management. So if you have data currently that you need help organizing, or if you need a plan of how you're going to collect research data, we can help you with that as well. In addition to the education and training, we can also help you directly with your research, either through helping you design that research or helping you analyze and present the results of your research. And then this slide just gives you some examples of core services. So we can do a lot of consultation on study design and setting up your study, including how you're going to measure what you want to measure in your study, how many people you need, what sort of power you have to detect differences between groups. We can help you with the statistical design. If you have something that you've already written yourself, we'd be happy to review any grants or abstracts or manuscripts, whatever you want. We can provide feedback. As I said before, we can help with data analysis, any reports or summary, and then we can also help with interpretation of the analysis. So that's it. So thank you very much for your time and attention today. And as Katie said, we're available. So any questions, please take yourself off of mute on the phone, and we'll happy to answer anything.
So we have one question that says, how do you get started? Like, I guess in research maybe, or with your methods? Like, how would you start a project?
So that's a really good question, and that sometimes I think is the hardest part, trying to get started with a research project. And so if you have an idea already or have some topic area, we'd be happy to sit down with you and brainstorm ideas about a specific research project that you could do in that area, or how maybe you could go about it. So I would just recommend contacting Katie or myself, and we can help you try to get started. All right, we have another question from online that asks, can we speak to data ownership issues? That's also a very good question. I don't have a lot of background on data ownership issues. I think our regulatory knowledge core might have some more information on that, so you can contact the general CRCAIH information line if you want more information on that. All right, another question that came up was, how do you develop tribal research infrastructure? And that's another great question. That's one of the things that we kind of throw around a lot, is that's what we're trying to do, is develop tribal research infrastructure. But it's much more difficult to think about how that works practically. So I guess some of the things that we're trying to do are, while we're here through the Methodology Core, providing some of that expertise that you might need to get started or to get things going a little bit. And then our hope is that through our training programs or working with us, we can help you develop some of those resources yourself, So the next time you want to do a research project or you have an idea, you have the ability to kind of get started yourself and have developed some of that expertise that you can build up more research projects within your tribe. Anything else that you would like to add, Katie?
That's good.
All right. Well, thank you so much for joining us today for this research webinar. And again, if you have any questions or would like any assistance, if you have any trainings that you'd like to see, please contact Katie Burgess or myself, or you can contact the general CRCA email address or phone number, and they can direct you to us as well. So thank you again, and have a great afternoon.